to Yoga Core and Pelvic Floor. I am Buffy Stinchfield, the creator of this class, and I am so glad to have you with us. If you haven't seen me on social media, you can find me at the Pelvic Health Coach. So welcome. Just a little bit about me. I have been a physical therapist since 2006 and specialized in pelvic health starting in 2010. I've got 3 children and have been a business owning and homeschooling mother for many years at the same time. Like many of us, I suffered with my own pelvic health issues that led me to becoming a specialist to basically fix myself. And through that journey, I have learned to love empowering other women for them to get over with and move forward so that they can learn about their bodies, heal, and then thrive. So as we go along in this course, you're going to realize that with this course, whether you are in here just to improve your knowledge about pelvic health, maybe you're a health provider or a fitness educator, or you've got an issue, you've got questions, I want you to understand that one of the biggest stumbling blocks for all women is with our core and pelvic health. Issues like bladder irritation, bladder leakage, painful sex, painful periods, back pain, tailbone pain, hip pain, and pelvic organ prolapse are very, very common. These issues can affect the quality of our lives anywhere from childhood all the way through menopause and beyond. The process of becoming pregnant and recovering postpartum is also a really common time for us to begin to take note of our core and pelvic floor system. But unfortunately, even if we are paying attention, women are often misguided by medical professionals and friends and family alike with advice like bladder leaks are just normal after having babies, or just do Kegels, or just stop running and weightlifting, or just have wine after having or before having sex. Painful cramps run in the family, just take an Advil, or your body will never be the same after having babies. Have you heard any of these? So, to make matters worse, there is a culture of shame related to our pelvis, which is glaringly obvious in all facets of life. Once a child moves past that initial potty training, like age 3, any topics related to the bathroom or pelvic health are often ruled TMI and not to be talked about. And universities that are teaching our doctors and physical therapists are typically not including any curriculum on pelvic health. And yet, it can affect half of all women in their lifetimes. Kind of crazy, right? I'm hearing that this is beginning to change in the university system, but the deficits are still an issue for most of us. So the goals for this class, it's about teaching you the foundations of a healthy core and pelvic floor system and exercises that can help you better connect your core as well as create a better foundation in your body that will result in a healthier core, pelvic floor, back, hips, and yes, more. This class is not about how to do a better Kegel, which so many of my past patients have anticipated that they would learn coming at their first visit. Okay, let's get to it. So, some women's health stats and facts. About a third of all women will have some issue with core and pelvic floor health. Now, I said before half because you'll see there's multiple stats that have come out in the literature. So, it's estimated on the very low end, at least 30%. But just so you know that we're going to get into this, the diaphragm, the abdominals, and the pelvic floor are normally supposed to move together with inhaling and exhaling, but not in all women, even young women without any injuries or having had babies. Up to 50% of women will experience pelvic pain in their lifetime. See how I said that the studies show us lots of numbers. Up to half of all women will experience some degree of pelvic organ prolapse. At least 30% of all women will experience urinary incontinence of some form in their lifetime, but that percentage only increases after we move past age 40. And then lastly, a systematic review and meta-analysis published in the Journal of European Spine in 2018 reported that the prevalence of low back pain postpartum ranged from 24 to 90%, depending on the study. Okay, 90% having back. Yeah. Okay, so the plan for this class, it's going to be very straightforward. We are, number one, going to do a self-assessment screen for you to figure out where you are in your core and pelvic health journey. We're going to talk about it in this video, and then there's going to be a separate video so you can see me in a bigger screen to walk you through that self-assessment. Then there is going to be a separate video where we're going to go through the exercise flow. We can call it a yoga flow. It's going to challenge your connection and the 4 pillars of core and pelvic health, which we're going to get into. So the tools that you need for the class, basic things, yoga blocks 1 or 2 for sitting on. Or if you have a floor cushion, it's just nicer to not be sitting on your bottom. It's nicer to be lifted up a little bit. So like if you have a yoga cushion or bolster, that's great too. You need a broom or a dowel. And it could be a yardstick even. It needs to be about 2.5 to 3 feet long, just to go from the back of your head to your tailbone. You'll want 2 balloons and then a pair of scissors, and we'll show what you're going to use the scissors for. You're going to want just a floor space that you can do some in-place exercises. Yoga mat is optional, and then a chair for modification. Okay, so after doing pelvic health for a really long time, I found that I needed to summarize and make the complicated seem a little more simple and palatable for my patients. I didn't need to send them home on their first visit feeling super overwhelmed. So I have narrowed it down into the 4 pillars of core and pelvic health. No, I didn't learn this in school. I have just organized it to where people can understand how complicated something is in a simple way. So your deep core and pelvic floor muscles have common basic needs regardless of the person or the issue. Over the years, like I said, I found 4 main pillars for pelvic and floor health. Thinking in terms of these 4 pillars will help you at all phases of your life, including prenatally, while pregnant, postpartum, and much beyond. And you don't even have to have ever had babies to benefit from this. The needs are pretty much the same. So breath is the first pillar of core and pelvic health. Breath is the foundation of your core and pelvic floor muscle function. Through healthy and coordinated breath, our core muscle health can be restored and or maintained. In the journey to restore core and pelvic floor health, breath will always be a part of the first steps. While pregnant, breath work will help you to prepare to use your breath as a powerhouse tool during labor. Just so you know, if you have yet to be pregnant or you plan on being pregnant again. Alignment. Our muscles can only work optimally when our bodies are aligned well. Poor body positioning can put muscles into excessively long or short positions, which can make them extra tense or not be able to turn on at all. Imbalances in hip, back, and pelvic muscles can contribute to unwanted aches and pains in the back and the pelvis. Okay, coordination of the core and pelvic floor, that's the third one. So our deep core muscles need to first be able to coordinate together as a team, and you're going to see, we're going to deep dive into that, before you can even begin to work on getting stronger. This includes when pelvic floor muscles are stuck in a short and tense position. If they are really tense, they're not going to play well with the rest of the team. They're just not. So we must first help all these muscles regain normal tension and length before it's appropriate to improve strength. So just know with my patient population over the last 13 years at this point, 13, 14, I would say at least 60% of all my patients, whether they were leaking, they had a prolapse or pain, most women actually hold on to too much tension. And at first, they really struggle to let go. They cannot connect their breath to lengthening their pelvic floor. That's why this is a non-negotiable. And I would say, repetitively tensing your pelvic floor muscles alone will only lead to more leakage, pain, or pressure issues. And I hate to say it, but there are always gizmos and doodads that are marketed to us, aren't there? Think snake oil salesmen. There are things on the market right now that you might have seen an advertisement for that promise, if you sit on some chairs type device, for example, that if you sit on it and it zaps where you're sitting, your pelvic floor, that it's going to magically cause all those problems to go away. And I would say, kind of not. I've seen many patients that have tried these gadgets and potentially they get a little bit better for a short time, but then it just gets worse. And often I find they have no coordination. None of that integrates in how they move their body. It just doesn't work. So once our deep core and pelvic floor muscles are working together, we can move forward with getting us strong and resilient in our bodies. Okay, the fourth pillar, glutes. Our hip glute muscles are the foundation for our back, hip, knee, core, and pelvic health. Poorly activating glutes are an epidemic in chair-using societies. Regaining the ability to fully access our glute muscles can help resolve back pain, hip flexor tension, pelvic floor dysfunction, and core weakness. Now, the whole glute picture, just so you know, because we sit in chairs when we need to get up and out of them, we can end up, instead of using our glutes, we can use our thigh muscles and our low back. People that do live in societies where they squat to the floor, the only muscle that can get them up from that low squat is their glutes. But for us, from chairs and toilets, it's completely optional. So glutes, being the efficient muscles that they are, just decide not to participate. Okay, so, and pelvic floor muscles cannot function well if the glutes cannot stabilize and move the pelvis effectively, or I would say efficiently. Through the course of our pregnancies, women are often shocked to realize that their glutes became weak, along with their abdominals, by the time they deliver their baby. I don't know about you, but I remember distinctively one of my postpartum phases after having a baby. I walked by a mirror and noticed that my booty was very flat. I was kind of shocked. I didn't realize it, but when I was pregnant, my belly was so big, I didn't notice anything else. Okay, so this is a really, really important phrase, pressure management. If you have not heard of the concept of managing pressure, this may be the most important part of the class for you. When all four pillars are functioning well, we can move about in our daily life with the ability to manage pressure within our abdominal cavity. So if you're going, what the heck is that? Just think of a soda can. So this is what I call the soda can analogy of the core team. The soda can is only strong and unable to be crushed when it is fully sealed. If you think about a soda can, if a hole is poked anywhere in that can, the strength is lost. And I'm pretty sure we wouldn't feel confident in putting a foot on that can and stepping on it, right? We know it's going to explode. Our core muscle team is like a soda can with the diaphragm muscles on top, the pelvic floor at the bottom, and the abdominal muscles wrapping around all the sides. There is a group of back muscles called the multifidus that are also a part of this soda can team. When this core team works together as a coordinated team, we can manage pressure within our trunk. And this results in elimination or reduction of bladder leakage, improved low back support and reduced low back pain, reduced pelvic organ prolapse symptoms, improved overall core strength, and improved sport performance. And we're going to be way safer lifting with better lifting technique. Okay, for self-assessment time, we're going to talk through the self-assessment here, and then there will be a separate video with me in a bigger picture so I can do the testing with you. But we're going to talk through it. Okay, so we're going to be assessing breath, alignment, coordination of the core and pelvic floor, and then glutes get their own category. Okay, so starting in a sitting posture, so you can go through this with me. We're just going to know there's a separate video that I can demonstrate bigger. We're going to start in a sitting posture. You can sit down on your yoga block or blocks or a meditation cushion or bolster. And you're going to have your legs crisscross applesauce, or you can sit in a chair if you need to. Place one hand on your chest like this girl and one on your low belly. Okay, so you're going to take 4 very slow breaths. As you inhale, try to inhale through your nose. So inhale through your nose and blow out through your mouth. Now what we want is for the belly to move more than the chest hand. Okay, so we're going to belly breathe. We're going to bring the air in and let it drop down into our pelvis. So inhale and then exhale. Okay, if we try it 4 times, does it feel difficult? Does it feel like you can't get air down into your belly and you only want to lift up in your chest? That's really, really common. Okay, so some people feel like at first they feel like their hand and their chest and belly hands move the same. Okay, now if you can, try to get it down. If it just naturally went up, try to get it down into your belly. Okay, for some people, they do well, this is not written, by putting their hands on their rib cage on the sides and creating some pressure to the middle, and then try to cue themselves to just at least expand down into their low ribs, letting those ribs expand to the sides. Okay, that's an alternative test. Okay, so now once you have done this, and I have here, it is best to, once you've screened your body, it's best to try a couple different positions, which we're going to go through. It could be laying on your side with your top shoulder tipped back and your hand resting on your belly. So it would kind of be the opposite of like fetal posture, which so many people love to sleep in. So you don't want to be all curled up in a ball. Lay on your side and let your top shoulder tip back. You'll notice it really undoes any tendency for your body to grip and tense. Other people like hands and knees belly breathing. When you're on your hands and knees, though, you're going to want to think about, as you inhale, the belly hand is going to go out and down towards the floor as you inhale and draw back up to the spine as you exhale. Some women really like child's pose. Their nervous system feels safer here and they can let go. And then other people like trying sitting with your arms on the table and just leaning forward on the table and just trying to let your belly release with that inhale. Okay, so the question here is, we want to determine which posture is the easiest for you. Okay, now for the alignment, this is where I love the analogy of how the body is supposed to be. And I'm going to grab a couple yoga blocks. Okay, I've got my yoga blocks. So in this little screen, we want to imagine your rib cage block stacked over your pelvis block. And ideally, we want them to be parallel. An example of when they really change is pregnancy. Your ribs lift up and flare, your pelvis tips forward, helping your belly get longer and your back gets shorter. Oftentimes, we get stuck in this pregnant posture, and the body doesn't magically just return to this nicely aligned and stacked position. So, the test for this one is going to be using a wall. We're just going to lean against a wall, and you are going to have your feet about 18 inches away from the wall, your knees softly bent, and you're just going to try to align your head and your entire spine with that wall. Okay, that's just to see, can you get there? For different people at different phases in our life, maybe we've been in computer situations or we've just been leaning forward a lot. Getting the head to touch the wall might be really hard. If you find that you can't get your head to the wall, I often like to recommend folding a towel, like a hand towel, putting it behind your head and seeing if you can get that to touch the wall. I'll show you in the video. The bonus here is taking 3 belly breaths. Can you stay aligned and allow your belly to lengthen out with inhale and draw back in with exhale? It might sound so simple, but when we do it, it's actually hard. So now we're going to move on to coordination of your core and pelvic floor. So this is where I said for this class, we're going to need a couple things. One of them is a balloon. Okay, so we're going to do 2 challenges to see how does your soda can team work together. Now remember, soda can team is your diaphragm, your pelvic floor, and all of your abdominals around. So the balloon challenge, do not take it lightly. If you have a balloon with you right now, you can do it with me. Sitting tall, you're going to take a nice breath in, best to do it through your nose to prepare, and then you're going to do 1 good blow. Okay, so I want you to do that first, and then I want you to self-assess. It's the funnest part. I want you to self-assess what happened to your belly when you blew that balloon. Did you feel your belly move out, draw in, and then pelvic floor, the bottom of your soda can? Did you feel the pelvic floor create pressure down or lift up? Now, when the soda can team is working effectively, blowing up the balloon, the goal is for the air to go up, right? The diaphragm is pushing the air up and into the balloon. The pelvic floor and belly should work with it. So the belly and pelvic floor should draw in and up so that the whole team comes up versus diaphragm goes up and pelvic floor goes down. We should not be feeling downward pressure. Okay, now the cough test. So I'm reclined right now. You're going to put a hand on your belly, 1 or 2. While you are preparing, take a breath in through your nose, and you're going to do a single cough. And then just self-assess. Did you feel your belly move out or in? And pelvic floor. Did you feel it go out or out and down or in and up? So inhale and then, okay. Now, as we get into, or we will get into after this self-assessment, a coordinated deep core team will draw that belly and pelvic floor inward and upward to move and work with the diaphragm that is moving upward in both tasks. We just went over. Okay, glutes. This is the 4th and final pillar of core and pelvic health. Now, I've got this picture of this gal. She is doing a chair pose, which is yoga, and I have no idea by this picture if she's actually using her glutes, just so you know. She might be in the perfect position, but she might be feeling only her thigh muscles doing the work. That's not good enough, okay? So we are going to tackle, do your glutes know how to work? And when I say work, I mean when you hinge, are the glutes on board? Or do you feel other muscles in your body doing the work? Your low back? Do you feel your thigh muscles doing all the work? And are the glutes asleep? Unfortunately, like I alluded to, living in a chair using society does not help us keep our glutes active. So we really have to fight to keep them on, and they are our best friends. So we are going to need, this is where you're going to need your dowel or broom or yardstick, some kind of stick. It's about 2.5 feet long, 2.5 to 3 feet. I just have a dowel. And I'm going to try to show it so you can see me in this little picture, and then we'll do it on our bigger video. You're going to stand, as you can read, with the dowel behind, touching your head, bra line, and tailbone. And you're going to just hinge at your hips with your knees staying straight. Can you hinge at that ball and socket hip joint? Keeping those 3 points touching. Now, one thing that often happens for people is their back will round and that dowel goes far, far away from the tailbone. That is not what we want. And then to make it a challenge, this is a 2-step thing. You squeeze and activate your glute muscles and then try to keep them on while you hinge at your hips. Okay, so that is the goal. And you're going to find, I'm going to go back to this. This may seem silly, this little test, but it is so, so crucial. Often, like I said, in our chair using societies, humans have lost the ability to hinge at the hips with their glutes on at all. Instead, our bodies are hinging, like I alluded to, in your low back, or you're overusing your low back muscles and the glutes just stay off. This leads to a lot of body imbalance issues, including back and pelvic floor dysfunction. Okay, so other muscle groups that will pay a hefty price by overworking to help out those non-working glutes is your hamstrings. I would also say your quadriceps, so the thigh muscles in the front too. That's going to strain the knees more. Hip flexors, so that's in the groin, and your pelvic floor muscles. These muscles will let you know that they're overworked by chronically staying tight and tense. No amount of massages and stretching will resolve these overtight muscles. Getting the glutes back on with daily life is the remedy that they desperately need, just so you know. Okay, so glutes and hip strength. Were you able to, this is the question once we do this, were you able to hinge with the dowel stay in contact with all 3 points? And then how far were you able to hinge when you tried to get your glutes on? 10 degrees, 20, 30, all the way because you're so amazing. Really, really go slow when we do this exercise. You can't do it fast because you won't be able to sense or tell that your glutes shut off on you, okay? Okay, so the next steps, you can click on the course menu and watch the separate self-assessment video, which I strongly recommend. That's why you're here. I want you to get a good self-assessment. And then once you've done that self-assessment, go to the exercise flow video so that we can start integrating the 4 pillars of core and pelvic health with movement. Okay, so for the exercise flow, remember that you're going to need yoga blocks or a floor cushion to sit on, a broom or dowel, because we're going to do that exercise just like we did in the test, 2 balloons, and a pair of scissors, floor space for in-place exercises, a yoga mat is optional, and then a chair for modifications. Okay, I look forward to helping you with this test so you can get a better self-assessment, and then I will see you on the exercise space.